feel too good.
Are you okay?
I'm just feeling a little dizzy.
What would you like me to do?
I don't know.
Excuse me. My daughter's not feeling well and I'm not sure what to do.
I can help, but first I need your permission.
Yes, that would be great. I need to call her father to see if he can come pick us up. They're over there.
I'll stay with the girls until you return.
Thank you so much.
When you recognize a possible illness or injury, activate your facility's emergency action plan. Let your team know you are responding.
Here comes the lifeguard now.
Survey the scene as you approach the victim. Determine if the scene is safe, what might have happened, how many victims are involved, and if any bystanders can help.
Hi there. Are you all right?
I don't feel too good.
Do you know what happened?
Well, we were talking for a little while, and then she started feeling sick.
What's your name?
Jessica?
Hi, Jessica. I'm Melissa. I'm a lifeguard. Is it all right if I help you? All right. Then what
Always
happened?
follow basic precautions to prevent disease transmission.
Feel dizzy?
Once you have determined that the victim is conscious and breathing and has no life-threatening conditions, do a secondary survey to learn more about the victim's condition. To begin, interview the victim and bystanders.
Do you take any medication?
Ask the
She got up, and then she had to sit back down because she was feeling dizzy.
I guess I was just dizzy for a while.
Do you feel any pain anywhere?
On my knee.
Which knee? Oh, those bites look bad. What happened?
I guess the bugs just really like me.
All right, Jessica. Do you have any medical conditions or do you take any medicines?
No.
Do you have any allergies?
No.
When did you last have something to eat or drink?
Just a minute ago, I had a hot dog and some soda.
All right, Jessica, could you look at me?
Next, do a visual head-to-toe examination. Begin with the head. Look at the face, ears, nose, and mouth. Note the coloring of the face and lips. Look at the skin. Is it moist or dry, pale or flushed? Work your way down to the body. Ask the victim to shrug her shoulders.
All right. Good. Now, could you take a deep breath and then let it out like this?
To check the chest, ask the victim to take a deep breath, then blow air out.
Now, could I get you to wiggle your... Good job. Jessica and I were just talking, trying to find out how she's feeling.
Well, I just called her dad, and he'll be here in a few minutes. I'd like to go meet him. Do you mind staying with Jessica?
Oh, not at all.
Thank you so much.
Second survey, provide care for the conditions you find. Have the victim rest comfortably until she is well enough to leave or until EMS arrive and take over.
Is that all right?
If EMS personnel take over, be sure to share the information you have about the situation. It may be very helpful, especially if the victim becomes unresponsive before they arrive. In review, to do a secondary survey, interview the victim and bystanders.
Do you know what happened?
Get any information from bystanders that may be helpful. When you interview the victim, ask the following questions.
Feel any pain anywhere?
Do you feel pain anywhere? Do you have any medical conditions or take medication? Do you have any allergies? When did you last eat or drink anything?
All right, Jessica, could you look at me?
Do a visual head-to-toe examination.
I'm gonna have Michelle
Provide care for the conditions you find.
Is that all right?
When someone becomes sick, you may not know exactly what is wrong. By recognizing the signs and symptoms of sudden illness and acting quickly, you can help save a life. Sudden illnesses include seizures, diabetic emergencies, stroke, poisoning, and allergic reactions. Victims of sudden illness may show a wide range of signs and symptoms. A common sign of sudden illness is a change in mental state, such as confusion, dizziness, or disorientation.
Jack. Jack? Jack? Jack, are you all right?
Survey the scene to be sure it is safe. Follow basic precautions to prevent disease transmission.
It's Annie. I know first aid. Can I help you?
Yeah.
Okay. I need some help here! Okay, let me...
Wrong.
Oh. Yeah.
Oh, 1-1.
Yes, thanks.
Even if you cannot identify the specific sudden illness, follow these general steps. Call 911 or the local emergency number. Do a primary survey and care for any life-threatening
A
conditions.
person who's conscious, but they're really sick.
Okay, can you tell me where you're...
Oh, what happened?
You got sick. Do you know where you are?
Yes. I'm in my office.
Continue to monitor the victim's airway, breathing, and circulation.
Do you have any medical conditions?
Watch for changes in consciousness.
Are you taking any medications?
EMS is on its way.
Here, keep him warm.
Keep the victim from getting chilled or overheated.
Don't worry, help is on its way.
Keep the victim comfortable and reassure the victim. Do not give anything to eat or drink unless the victim is fully conscious. Sudden illness can also occur in the water. You may not know what is wrong with the victim. Once you recognize an emergency and activate the emergency action plan, caring for sudden illness will generally be the same. For example, if a person has a seizure in the water, follow these steps. Call 911 or the local emergency number. A victim of seizure in the water may have aspirated water. Support the victim's head above water until the seizure ends. After the seizure ends, remove the victim from the water as soon as possible. Provide follow-up care. Monitor the victim's airway, breathing, and circulation. Care for any life-threatening conditions. During a seizure, the body may stiffen and then convulse. The victim may experience difficulty breathing. Do not hold or restrain the victim or place anything between the victim's teeth. Remove any nearby objects that might cause injury. In a diabetic emergency, a victim may show signs such as dizziness, disorientation, or fainting, deep rapid breaths, or convulsions.
Are you okay?
I'm a diabetic.
My name's Catherine. I'm trained in first aid. Can I help you?
Yes, I need my medicine. It's in my purse.
Which pocket is it in?
The front one.
Front one? Okay.
Call 911 or the local emergency number if
How about you
appropriate.
just sit back and relax?
Keep the victim comfortable and care for the conditions you find. A person having a stroke may show these signs and symptoms: confusion, dizziness, or disorientation, difficulty breathing, paralysis to the face, arm, or leg, usually to one side, difficulty with speech, vision, or walking, or severe headache. A stroke requires advanced medical care immediately. Call 911 or the local emergency number.
down here. I know first aid. Can I help?
Yes, please.
A person who has been poisoned or has an allergic reaction may show these signs and
I'm gonna
symptoms:
wash this out.
confusion, dizziness or disorientation, difficulty breathing, coughing, back pain, abnormal pulse rate, sweating, vomiting, or nausea.
All right, we're gonna need to wash this out. Come with me.
If the person tells you they are allergic, or if they begin to show signs and symptoms of poisoning or an allergic reaction, call 911. Other times you should call 911 or your local emergency number for sudden illness are: if the victim is unconscious, is unusually confused, dizzy, or seems to be losing consciousness, has difficulty breathing or is breathing in a strange way, has persistent chest pain or discomfort, has persistent abdominal pressure or pain that will not go away, is vomiting blood, has seizures, severe headaches, or slurred speech, or appears to have been poisoned.
I need help here!
To review, to care for a victim of sudden illness, follow these general steps. Call 911 or the local emergency number. Do a primary survey and care for life-threatening conditions. Watch for changes in consciousness. Keep the victim comfortable and reassure the victim.
Don't worry, help is on its way.
Keep the victim from getting chilled or overheated. Do not give anything to eat or drink unless the victim is fully conscious. Continue to monitor the victim's airway, breathing, and circulation.
What happened?
I cut myself on the table.
A wound is an injury to the body's soft tissue, the skin, fat, and muscles. Bleeding occurs when blood vessels or arteries are broken. Internal bleeding occurs inside the body. It may be as simple as a bruise or as serious as a ruptured artery, which cannot be seen. A bruise is caused by damage to blood vessels in the soft tissue, which results in bleeding under the skin. External bleeding occurs when there is a break in the surface of the skin. Different types of injuries that may involve external bleeding include: an abrasion is skin that has been rubbed or scraped away. A cut may have either jagged or smooth edges. Deep cuts can damage nerves, large blood vessels, and other soft tissue. A puncture is a wound caused when an object, such as a nail, pierces the skin. An avulsion is a cut in which a portion of skin or other soft tissue is partially or completely torn away.
I want you to apply some pressure to that.
Minor bleeding is easily stopped with light pressure and elevation.
Okay.
Call 911, I have severe bleeding.
Severe bleeding is a life-threatening condition. Be sure to call 911 or the local emergency number immediately.
Take your hand, place it over the cut, and apply pressure.
When caring for any kind of bleeding, follow basic precautions to prevent disease transmission. To care for a bleeding wound, first, cover the wound with a dressing, such as a sterile gauze
Okay, move your
pad.
hand.
Apply direct pressure against the wound.
I've called 911, and they're on their way.
Okay, great. Let's get the chair and help her sit down.
Elevate the wound above the heart. Elevate only if you do not suspect a fracture. Cover the dressing with a roller bandage. Use overlapping turns to completely cover the dressing. Secure the bandage by tying a knot directly over the wound. If the bleeding does not stop, apply additional dressings and bandages. If bleeding still does not stop, use a pressure point. Find the appropriate artery and squeeze the artery against the bone. Squeezing an artery against a bone slows down the flow of blood beyond that point. There are 4 locations on the body called pressure points that are commonly used to help control bleeding. The pressure points for the arms are on the brachial arteries, located on the inside of the upper arm. The pressure points for the legs are on the femoral arteries, at the front of the leg where the hip bends. If the bleeding still does not stop, continue to apply pressure and take steps to minimize the effects of shock. Any serious illness or injury can cause the condition known as shock. Shock is the body's natural attempt to keep blood containing oxygen flowing to the most important organs of the body, such as the brain, heart, and lungs. Signs and symptoms of shock include restlessness or irritability, changes in consciousness, pale, ashen, cool, or moist skin, rapid breathing, rapid pulse, a blue tinge to the lips and nail beds, and nausea and vomiting.
Just relax. Help is on the way.
Take steps to minimize the effects of shock. Make sure 911 or the local emergency number has been called. Continue to monitor the victim's airway, breathing, and circulation. Control any external bleeding. Keep the victim from getting chilled or overheated. Elevate the legs about 12 inches if you do not suspect a fracture or a head, neck, or back injury. Comfort and reassure the victim until EMS personnel arrive and take over.
Just relax. Help is on the way.
To review, when caring for a wound that is bleeding, follow basic precautions to prevent disease transmission. Cover the wound with a sterile dressing. Apply direct pressure against the wound. Elevate the injured area above the heart, but only if you do not suspect a broken bone or a head, neck, or back injury. Cover the dressing with a roller bandage and tie directly over the wound. If the bleeding does not stop, apply additional dressings and bandages. If the bleeding still does not stop, use the appropriate pressure point. If necessary, care to minimize the effects of shock until EMS personnel arrive and take over.
Just relax. Help is on the way.
You look really sunburned. Really?
There are several different types of burns. Solar or radiation burns are caused by too much exposure to the sun. Chemical burns occur when certain chemicals come into contact with the skin. Electrical burns result when electrical current, such as from a power line, comes into contact with the body. Thermal burns are caused by contact with extreme heat. They result in damage to the skin and underlying tissue. The severity of a burn depends on the temperature or intensity of the source of the burn, the length of exposure, the location of the burn, the area and size of the burn, the victim's age and medical condition. The severity of a burn depends on how many layers of soft tissue have been burned. A superficial burn, also called a first-degree burn, may only affect the surface layer of the skin. The skin is red and dry. A partial thickness burn, also known as a second-degree burn, forms blisters and affects deeper layers of the skin. The blisters may be open and weep fluid, making the skin appear wet. A full-thickness burn, also known as a third-degree burn, is the most severe burn. It affects skin and soft tissue down to the bone. The skin may be brown or black, with tissues underneath appearing white. Some burns can be life-threatening. Call 911 or your local emergency number immediately if the burns appear around the mouth and nose or cause a victim to have difficulty breathing. If the burns cover more than one body part or more than 10% of an adult's body surface. If burns appear on the head, neck, hands, feet, or genitals. if they are on a child, an elderly person, or a person with a medical condition, or if there are burns resulting from chemicals, explosions, or electricity.
Mike, go call 911! First thing we need to do is cool this burn.
To care for burns, flush the burned area with cool water. Cover the burned area with dry, sterile dressings. Loosely bandage the dressings in place. Finally, because any serious injury or illness can cause shock, take steps to minimize the effects of shock and comfort the victim.
Now just relax, and I'm going to wait here with you until the paramedics arrive.
Can I get some help, please?
If a burn is caused by a liquid chemical, flush the area continuously with large amounts of cool water. Continue flushing the burn until EMS arrives and takes over. If the chemical is dry, brush the chemical off with a gloved hand. Be careful not to get the chemical on yourself or in the eyes of the victim. If the burn is caused by electricity, do not cool the burn or flush it with water. Cover the burn with a dry, sterile dressing and bandage loosely. Take steps to minimize the effects of shock.
Mike, go call 911! First thing we need to do is cool this burn.
To review, to care for a burn, flush with cool water. Cover with dry, sterile dressings. Bandage loosely, and take steps to minimize the effects
now
of
just
shock.
Relax, and I'm going to wait here with you until the paramedics arrive.
And brush dry chemicals off with a gloved hand. Do not use water on an electrical burn. Instead, cover with a dry, sterile dressing and bandage loosely.
Walk, please!
Injuries to muscles, bones, and joints can occur as a result of accidents
Hey.
at your facility.
My name's Brian. I know first aid. Can I help?
Yes, please.
As a lifeguard, you need to know how to recognize and care for such injuries.
What's your name?
There are 4 types of muscle, bone, and joint injuries: fractures, dislocations, sprains, and strains. It can be difficult to tell the difference between these types of injuries, but the care you provide is the same. Immobilize and secure the injured area only if the victim must be moved and it does not cause further pain or injury.
Please call 911.
Sure.
Can you feel this? Yes. Can you wiggle your fingers?
If the victim is unable to move or use the injured area, or if you suspect a head, neck, or back injury, call 911 or your local emergency number.
This is a sling. This is going to hold your arm in place.
To care for a muscle, bone, or joint injury,
Real still.
support the injured area above and below the site of injury. Splinting is a technique used to immobilize the injured area and keep it from moving. For an arm injury, a sling and binder can be used to immobilize the area above and below the injury. Splint the injury in the position you find it. Do not try to straighten or move the injury. Check for feeling, warmth, and color below the injured area.
Can you feel this?
Yes.
Can you wiggle your fingers?
If the injury is to a bone, immobilize the joints above and below the bone. To immobilize other common muscle, bone, and joint injuries, use another body part to splint the injured area. For example, an injured leg can be splinted to the other leg. A finger to a finger, or an arm to the chest. To immobilize an
Real
arm
still,
injury,
okay?
leave the arm in the position you find it. To form a sling, thread a triangular bandage under the injured arm and over the uninjured shoulder. Tie the ends of the sling at the side of the neck on the uninjured side. Place gauze pads under the knots to make it more comfortable for the victim. Bind the arm to the chest with a folded triangular bandage. Recheck for feeling, warmth, and color
feel
below
this?
the injured area.
Yes.
Can you wiggle your fingers?
Yes.
Are you
Continue
okay?
to monitor the ABCs and watch for changes in consciousness. If you suspect a head, neck, or back injury and the victim is on land, stabilize the victim's head by holding it in line with the rest of the body, whether the victim is lying down, standing, or seated. This technique can be used to help minimize further injury until EMS personnel arrive and take over. By recognizing a possible head, neck, or back injury and acting quickly, you may be able to injured area. To care for a muscle, bone, or joint injury, support the injured area above and below the site of the injury. Splint the injury in the position you find it. Check for feeling, warmth, and color below the injured area. Immobilize and secure the injured area.
Can you feel this?
Recheck for feeling, warmth,
wiggle your
and
fingers?
color below the injured area. Remember to splint the injured area only if the victim must be moved and does not cause further pain or injury. Exposure to extreme heat can make a person ill, but even when temperatures are not extreme, a person can develop a heat-related illness. The risk of a heat-related illness depends on the person's age, physical activity, general working or living conditions, state of health, and other environmental conditions such as wind and humidity. Heat-related emergencies occur when the body overheats and is not able to cool itself effectively. Heat exhaustion is the most common type of heat emergency. The signs and symptoms of heat exhaustion include cool, moist, pale, flushed, or ashen skin, headache, nausea, dizziness, weakness, and exhaustion. If not cared for promptly, heat exhaustion can progress quickly to heat stroke, a life-threatening condition. The signs and symptoms of heat stroke are changes in the level of consciousness, high body temperature, red, hot skin that can be either dry or moist, a rapid or weak pulse, and rapid or shallow breathing.
You okay? Oh, I'm just hot and tired. I've got a headache. My name's Lewis. I'm trained in first aid. And you don't look so well. Can I help you? Yeah, sure. First, we need to get you out of the sun. Easy, here we go.
To care for a victim of a heat-related emergency, move the victim to a cool place. Loosen or remove clothing.
Okay. It's kind of hot out here, so probably help if you remove your shirt so you can cool down a little bit.
If necessary, get the victim into circulating air and apply water with a cloth or sponge.
How you feeling?
Got a headache, man.
Yeah. Does that help?
If the victim is conscious, give small amounts of cool water to drink.
Want to relax? Now remember to take short sips. You don't want to drink too much at one time. And if you want, you can take a little bit of that and kind of dash it on you just to kind of help you cool down and relax a little bit.
If the victim's condition does not improve, or if you suspect heat stroke, call 911 or the local emergency number. Continue to give care and monitor the victim until EMS personnel arrive and take over. To review, to care for a victim of a heat-related emergency, move the victim to a cool place. Loosen or remove clothing. If necessary, get the victim into circulating air and apply water with a cloth or sponge. Call 911 or the local emergency number if the victim's condition does not improve or if you suspect heat stroke.
it's cold.
Is it too cold?
No, it's fine. What's this?
That's great, hon.
Overexposure to cold can make a person ill. Even when temperatures are not extreme, a person can develop a life-threatening illness called hypothermia. Susceptibility to hypothermia depends on a person's age, physical activity, general working or living conditions, state of health, and environmental conditions such as wind and humidity.
It's cold, Mom.
Do you need to get out?
Hypothermia occurs when the body can no longer keep itself warm and the body temperature begins to drop. Without proper care, pulse and breathing will slow down and body systems will progressively fail.
Mom.
She looks very cold.
Yes, she does.
Could I get you to grab that towel and wrap it around her? My name's Melissa. I'm a lifeguard trained in first aid. Would it be all right if I helped your daughter?
Of course.
All right, sweetie, what's your name?
Prolonged exposure in water or
Courtney,
wet
can I get you to
clothing
sit down
can
over here
contribute
for me?
to the onset of
That
hypothermia.
towel wrapped warm around you. All right, Courtney, can you...
Signs and symptoms of hypothermia include shivering, a slow, irregular pulse, numbness, a glassy stare, apathy or impaired judgment, and loss of muscle control.
Courtney, how do you feel?
I can't feel my fingers and my legs are really numb.
All right, Courtney, can I get you to look at me? Good.
As hypothermia progresses, a victim may stop shivering or lose consciousness.
I think we need to get her inside where it's warm.
Okay.
To care for hypothermia, wrap the victim in dry clothing or towels as quickly as possible. Warm the victim slowly and handle her carefully. If the victim's condition does not improve, call 911 or your local emergency number. Take steps to minimize shock if necessary. Continue to provide care and monitor the victim until EMS personnel arrive and take over.
Head, neck, and back injuries rarely occur in a well-supervised aquatic facility, but injuries can occur from falls, collisions, and head-first entries into shallow water. If you suspect a swimmer has an injury to the head, neck, or back, you must use rescue skills developed specifically for head, neck, and back injuries. Because injuries to the head, neck, and back can result in permanent disability or death, recognizing and caring for head, neck, and back injuries are important lifeguarding skills.
Guards are on the way out.
Head, neck, and back injuries can result from a number of actions. For example, someone who dives headfirst into shallow water may strike his head on the bottom. You should always suspect a possible head, neck, and back injury in the following situations: any headfirst entry into shallow water, any injury involving a diving board or water slide, entering water from a height greater than the victim's height, a fall on land from a height greater than the victim's height. Also, look for signs and symptoms that indicate a possible head, neck, and back injury. These include head, neck, or back pain, loss of balance, loss of body movement below the injury site, difficulty breathing, tingling or loss of sensation in the arms, legs, hands, or feet, bumps, bruises, or depressions on the head, neck, or back, dizziness, confusion, or loss of consciousness, seizures, blood or fluid in the ears, or complete or partial inability to move arms and legs. If you suspect that a victim has a head, neck, or back injury, activate your facility's emergency action plan. This alerts other guards and staff to the emergency. Minimize movement of the victim's head, neck, or back. Hold the victim's head in line with the body. This is called in-line stabilization. Position the victim face up at the surface of the water so that the victim can breathe. Check for consciousness and breathing.
Hi.
Okay.
A victim who can talk to you is conscious and breathing. Move the victim to shallow water whenever possible. Immobilize the victim on a backboard and remove the victim from the water. Once the victim is removed from the water, always follow basic precautions to prevent disease transmission, such as using disposable gloves and breathing barriers. There are 2 techniques you can use to minimize movement of the victim's head, neck, or back while the victim is in the water. The head splint and the head and chin support are 2 techniques used for victims who are face up or face down in the water. Use the head splint technique on a face-up victim in shallow or deep water, at or near the surface. To perform the head splint for a face-up victim in shallow water, stand behind the victim's head. Submerge so the water level is at your neck. Grasp the victim's arms midway between the shoulder and elbow. Gently place the victim's arms alongside the head and squeeze them together. This helps keep the head in line with the rest of the body. Reposition yourself to the victim's side as you secure the head with the arms. Position the victim's head close to the crook of your arm, making sure that the head remains in line with the rest of his body. Maintain the victim in this position until help arrives. You may also use the head splint technique for a victim who is face down at or near the surface of shallow or deep water. The head splint technique provides inline stabilization and turns the victim face up so that she can breathe. In deep water, use the rescue tube for support. First, approach the victim from the side. Grasp the arms midway between the shoulder and elbow. Place the victim's arms alongside the head and squeeze them together. This helps keep the head in line with the rest of the body. Glide the victim slowly forward. As you move, rotate the victim toward you until her face is out of the water. Position the victim's head close to the crook of your arm, making sure that the head remains in line with the rest of her body. Maintain this position in the water until help arrives. The other technique you can use to stabilize an injury to the head, neck, or back is called the head and chin support. You can use it for victims who are face up or face down in the water. You can also use it to remove a victim of head, neck, or back injury from the bottom of a pool. Approach a victim who is face up from the side. Place one of your forearms along the length of the victim's breastbone and grasp the jaw. At the same time, place your other forearm along the victim's spine and grasp the back of the head. Gently position the victim's head in line with the rest of the body.
It's all right. More help is on the way.
For a victim who is face down in the water, this stabilization technique remains the same, except you need to turn the victim face up in order for him to breathe.
Hi.
Okay.
Approach the victim from the side and use the head and chin support to stabilize his spine. Move forward and rotate the victim toward you as you submerge. Maintain inline stabilization as you roll slowly under the victim. Surface on the other side, bringing the victim's face out of the water. Keep the victim stabilized in this position until help arrives.
Bring the backboard. Forward.
A victim with a suspected head, neck, or back injury must be immobilized on a backboard before you can remove him from the water. At least 2 lifeguards are needed to perform this skill, but use additional help whenever possible. There are several types of backboards in use today. A backboard may be made of fiberglass, polyurethane, or marine plywood. They vary in size, shape, weight, and buoyancy. The straps that secure a victim to the backboard also come in different styles and configurations. Head immobilizers are attached to the backboard to minimize movement of the head and neck. Practice using your facility's backboarding equipment until you can maneuver it smoothly.
Bring the backboard.
Whenever possible, immobilize a victim on a backboard in shallow water and bring the victim toward the side of the pool. Submerge the board and position it under the victim so that it extends beyond the top of the victim's head when it is raised into place. When using the head and chin support, carefully withdraw your arm from beneath the victim as the board is raised into place. Maintain your grasp on the chin with one hand and use the other hand to support the board from underneath. The second lifeguard moves to the head of the board and rests the board against her chest. Grip the sides of the board between your forearms and place your hands against the victim's head, holding it in line with the body.
Got it.
The first lifeguard is now free to secure the victim to the backboard. Secure a strap high across the victim's chest, just under the armpits. This helps prevent the victim from slipping down on the board during removal from the water. Place another strap across the hips. Be sure that the victim's hands are secured under the strap, either to the sides or on top of the body. Place a third strap across the victim's thighs.
Stabilize the head.
Use a head immobilizer to secure the victim's head. Be careful to keep the victim's head from moving as you place a pad on each side of the head. Finally, secure the victim's head with a strap positioned low across the forehead.
Bring the backboard.
When stabilizing a victim using the head splint technique, there are a few modifications in the backboarding process.
Lower the board.
Once the board is raised into place under the victim, the second rescuer takes over inline stabilization using the head and chin support.
Stabilize the head.
Place one of your forearms along the length of the victim's breastbone and support the chin. The other forearm supports the underside of the board. The first lifeguard removes his arm from under the victim's head, gently slipping it toward the head of the board. The first lifeguard carefully places the victim's arms at his sides. He then rests the board against his chest and takes over inline stabilization.
I got it.
The second lifeguard is now free to secure the victim to the backboard.
Everything's going to be just fine.
Once the victim is secured on the backboard, work together to remove him from the water.
I'm going to remove you from the water. Move to the side, please.
Lift the head of the backboard and place it on the edge of the gutter or deck. The second lifeguard helps support the board while the first lifeguard climbs out of the pool. The first lifeguard grasps the head of the board, and the second lifeguard moves to the foot of the board. On the first lifeguard's signal, both rescuers begin to slowly remove the victim.
Short lift. 1, 2, 3.
The first lifeguard stands up and steps backward, pulling the board towards him, while the second lifeguard guides the backboard up onto the pool deck.
Everything's all right.
If the victim is in deep water and cannot be easily removed to shallow water for boarding, adapt your skills to immobilize and remove the victim safely.
Can you feel your legs?
To perform the head splint on a face-up victim in deep water, approach from behind the victim's head. Grasp the victim's arms midway between the shoulder and elbow. Gently place the victim's arms alongside the head and squeeze them together. This helps keep the head in line with the rest of the body. Reposition yourself to the victim's side as you secure the head with the arms. Position the victim's head close to the crook of your arm, making sure that the head remains in line with the rest of her body. Maintain the victim in this position until help arrives. If the victim is face down at the surface in deep water, use the head splint to turn the victim face up. Keep your rescue tube in place for support.
I'm a lifeguard. Are you all right?
I don't know.
Do you hurt anywhere?
My head.
Can you feel your legs?
No.
If the victim is face up at or near the surface in deep water, keep your rescue tube across your chest and use the head and chin support to stabilize the spine. If the victim is submerged, leave your rescue tube at the surface and do a feet-first surface dive to reach the victim. Use the head and chin support to stabilize the head, neck, and back, and bring the victim to the surface at an angle. As you near the surface, rotate the victim to a face-up position. A second lifeguard can retrieve your rescue tube and place it under your arms to help support you and the victim. Move the victim to the side of the pool.
Okay, you're going to be fine. We're going to put you on a board, okay?
To immobilize a victim on a backboard in deep water, support the victim at the surface. A second guard submerges the backboard under the victim.
Okay, float it up.
When the board is in place, the second guard moves to the head of the board, supports the board on the rescue tube, and provides inline stabilization of the victim's head.
All right, you all right, Matt?
Yeah.
Okay.
Once the victim is secured, place the head of the backboard on the edge of the gutter or deck.
Just lift it up. All right, you hold the gutter. I'm fixing to climb out. You got it?
The second lifeguard supports the board while the first lifeguard climbs out of the pool. On command, the first lifeguard grasps the head of the board, stands up, and steps backward, pulling the board towards him, while the second lifeguard pushes up from the water.
On three. 1, 2, 3. How you doing, buddy?
Remember, once you remove the victim from the water, always follow basic precautions to prevent disease transmission. Provide additional care as needed.
Probably the biggest difference is the large numbers that you handle. In a pool setting, you have a set number of people that are allowed in your facility. On a beachfront setting, the numbers can go from 10 all the way up into 5,000 to 10,000 people. All depends on the weather and what activity is going on.
It's important for a lifeguard to know where the shallow places are and where the deep places are, because people can walk out. They'll be shallow 1 minute and it can drop off immediately, and somebody might step off over their head.
With the river, you have to take into consideration there is a current, and the terrain is different. There's lots of rocks and sticks or whatever underneath the water. Also, there's more turbulence in the river compared to a pool.
It can create certain types of currents. It's very tough to try to swim against them. People just aren't strong enough to swim into the current and try to get back to shore.
You're all right.
You have to watch out for boaters coming into the swim area.
This is actually supposed to be a wakeless area where no boats are supposed to come in and break wake, and sometimes it'll happen, and it's a big distraction.
Weather is a big one. Like I know we've had a couple storms here that 1 minute the sky is blue and the next minute.
Off the beach area, electrical storm! Everybody off!
When people come out here, they think it's just a lake and they can just do whatever because it's not a pool, and they don't even notice that lifeguards are on duty half the time.
When you get a lot of kids that come in here that are just here for the day, they have a tendency to just be hyperactive, not really concerned about what the rules are, and reminding them about the rules is the biggest thing.
Yeah, a lot of times we do get the impression that we're supposed to be the quote babysitters of the beach. I'll go right up to the child and say, "Where's your mother?" And then I would go up to talk to the parent and said, just ask her nicely or him nicely to come down, and just keep an eye on their child.
Well, the area is definitely a lot bigger, so you have to make sure that you cover your area, and not only just your area, but the other lifeguards' area sometimes.
Just the whole beach idea is different.
Different atmosphere, big difference.
Alcohol on the beach is a big problem.
It's not just sitting in the chair watching and putting suntan lotion on you.
We hear that a lot, and a lot of people say, well, we'd love to have your job. I mean, it must be really nice. And it is. It's a lot of fun, but it's also a big responsibility.
Lifeguard is serious, but it's fun at the same time. I recommend it. It's a chance to work outdoors. It gives you a great physical stamina, endurance, the whole 9 yards. I mean, you get a lot from it. We pay attention to the swim area, the fishing areas, the kayak and windsurfing areas, and people on the beach. Safety of the people who are on the beach is one of the most important roles that a lifeguard can have. Always looking out for those people who don't know as much about the water as maybe you do.
Everybody that we can see is our responsibility.
The basic surveillance principles of injury prevention and victim recognition are the same at a waterfront as they are at any other aquatic facility. But at a waterfront, changing water conditions, large numbers of people, the variety of activities, water clarity and weather are just a few of the features that can make surveillance more challenging. At a waterfront, water conditions can change quickly. Wind, waves, currents, and wakes from powerboats can all cause changes in a waterfront swimming area.
Lakes or outside environment like this can also be dangerous because of hazards such as wind.
Today the wind is making a big current, and that takes some little kids under, and you just need to be aware.
You have to take into consideration there is a current. People that do come here, they try and swim across, and then they realize they have to get back, and the current, they never take the current into consideration either. Also, there's more turbulence in the river compared to a pool because of the boats that do travel by.
We can have a rainstorm north. It's not going to send a wave down the river, but the height of the river could go up within a day's time.
Unaware of the gradual change, swimmers could wind up in deep water where they were previously able to stand. Aquatic plant and animal life may also be a threat to swimmers. Check the swimming area regularly for hazards. If they exist, try to warn swimmers before they enter the water, and be aware that these conditions may change. Effective surveillance at a waterfront is also challenging because it is a less controlled environment than a pool. Crowds may be larger. You may encounter swimmers who are under the influence of alcohol or other drugs. Non-swimmers may venture beyond the safety lines. And children may play or swim unsupervised.
It was a little baby, and her parents weren't watching her, and she had wandered out in the water. And kids, they don't have any perception of depth or anything like that, so they'll walk right on out over their head. And I just happened to catch a glimpse of her, and she went under, and I ran out and got her before she even sucked any water.
Water clarity is still another factor in waterfront surveillance. The clarity of the water can also be affected by the glare of the sun. Other factors that will affect surveillance at a waterfront include the size and shape of the waterfront, the size and shape of docks, the types of activities that are taking place, and the number of lifeguards available to cover the area. Like pools, waterfronts use zone coverage to define the surveillance areas covered by each lifeguard on duty. Make sure you know the exact area you are assigned to cover. You should be able to see your entire zone and everyone in it at all times. You may also be responsible for responding to any incidents that happen within your view, even if they occur outside the marked swimming area.
I'm always keeping eyes on people that are in canoes, rowboats, sailboats. It's just habit when you've been lifeguarding for a while. It's just something you get used to, watching everybody around you.
Your facility may choose to set up an additional zone at the outer boundary of the swimming area. You may be stationed in a boat or on a rescue board, allowing you to be closer to swimmers who are at the far edge of the swimming area. At some facilities, personal watercraft are also used. In camp settings, where there is more control over swimmers, there will often be a buddy system in place to help you keep track of each swimmer. Buddy systems are especially useful with large groups of children. Each facility has its own procedure for a buddy system. But generally, swimmers are classified by their swimming ability and assigned to swim in a specific area.
Buddy check! Get your buddy!
Each swimmer is also assigned a buddy who will be swimming in the same area.
Okay, the next thing I'd like to explain to you is our board system. Now what you're going to do with this board, if you are a junior, your tag is blue. If you're an intermediate, your tag is red. If you are a senior, your tag will be white. Before you go out onto the H dock, you are to come out here, find your tag, and move it over to the inside. Okay? Now when you come out of the water and you leave the dock, you come over here, find your own tag, take it off, and put it back over on the outside. Does everybody understand? Okay, I'd also like to explain to you, we have a buddy system here at Camp Onika. Now what you're to do, when you're called down to come onto the dock, we will place you in a single file line and we will count you off by buddies.
Buddy 2? Buddy 3?
When you hear the lifeguard blow 1 whistle, you will get into the water. When you hear the lifeguard blow 2 whistles, you are to immediately find your buddy and get out of the water. When you hear 3 whistles, you can get back in.
Each waterfront facility has its own unique set of characteristics. As a lifeguard, it's your job to know and understand these characteristics and to adjust your surveillance techniques accordingly.
Keeping your focus among the patrons and keeping your attention, your eye on the water and all the potential hazards that there may be, and knowing that people are depending on me to be alert, to be aware, that's basically what's rewarding for me.
You either want to help people, you want to prevent things, or you just want to be helpful to anyone that you can. I mean, being a lifeguard has got to be the most important job around as far as I'm concerned.
Most of the rescue skills you already know also work well in an open water environment. However, at some facilities, the large size and design of the waterfront and changing water conditions make it necessary to use additional techniques and equipment. Most waterfronts have beaches that slope gradually into the swimming area. The entry you will use here is the run and swim.
It is important that you keep the area in front of the guard, chair, and the water clear, because you must be able to respond quickly to any action or anything that's going on. If there's anything in your way to slow you down, that's a step slower you are to get into your victim.
Lift your legs high to avoid falling. To do this entry, drop your tube as you enter the water. When you can no longer run, lean forward and start swimming. It's especially important not to dive or plunge in open water. It can be difficult to judge depth and see objects under the surface, and you could be seriously injured. Remember, you can get to the victim faster if you let the rescue tube trail behind you while you swim.
A little bit too far.
At a waterfront, there are several ways you can remove a victim from the water.
I got you, buddy.
If the victim can walk, use the walking assist.
I got you.
Place one of the victim's arms around your neck and over your shoulder, grasping his wrist.
You're gonna be all right, buddy. I got you.
Wrap your other arm around the victim's back or waist for support and maintain a firm grasp while you help him walk out of the water. If the victim is unable to walk, use the beach drag. Once you reach shallow water, stand up and remove your rescue tube out of the way so you do not trip on it. Firmly grasp the victim under the armpits and walk backward toward the shore.
What you really need to remember about the beach drag is to hold the victim securely in your arms and to use your legs and not your back. The less pressure on your back, the more secure you are with the victim, and you're able to pull them in as quickly as possible. It's always good to have an extra person there if you have it. As you're bringing the victim out of the water, the victim becomes heavier, so the extra person there is there to help you support the victim as you're bringing them out of the water.
Drag the victim far enough onto shore so that at least his head and shoulders are completely out of the water. Lower him gently to the ground and provide care. While the rescue tube will still be your primary piece of rescue equipment, at some waterfronts you will also use a rescue board. A rescue board is most valuable when there is a long distance between you and a swimmer who needs help. Using a rescue board involves learning a few skills. The first is how to launch the board and approach the victim. To launch a rescue board, grasp it firmly on both sides at about the middle of the board and enter the water. When you are about knee-deep in water, lay the board down and push it forward alongside you. Climb on just behind the middle and lie face down. Paddle a few strokes and bring yourself to a kneeling position.
The way I prefer to paddle a rescue board is from the kneeling position, because basically it allows me to get to a victim quicker. It's faster to paddle from the kneeling position, and I can focus and concentrate on the victim. It allows me to be a little higher than the water, and I can see the condition of the victim as I get there.
With practice, you'll be able to launch the rescue board and go directly into the kneeling position.
I found that rescue board can be a tough piece of equipment to master. In-service training is not enough for me. I have to get out and paddle the board, practice paddle the board, and also try and paddle the board in different weather conditions, because when the wind's up and the chop's up, it's harder to use, it's harder to maneuver, and it takes practice to be able to really get out and use the equipment like you really need to.
Help! All right, calm down, calm down. You're all right. I've got you. Just hold on to the board. All right. You calm? Mm-hmm. Here we go. Now I'm going to take you to shore. I'm going to help you up on the board. I want you to help me pull yourself up on the board. Lift your left leg. Here we go. Okay. Here we go. You're doing fine. You all right? Here comes help.
To rescue a distressed swimmer, approach from the side so that the side of your board is next to the victim. Grasp her hand or wrist and slide off the opposite side of the board. Try to calm the victim as you help her reach across the board and hold on.
There are a couple of hints I can give to you when using a rescue board to go help a distressed victim. First is the rescue board's your equipment. Always keep it between you and the victim. Second is to talk to the victim through the entire process. Talking to them helps calm them down, tell them what you're going to do, and then help them back to shore.
Kick to turn the front of the board, also called the bow, toward shore. Then, keeping the board as stable as possible, assist the victim onto the board and have her lie face down. Help the victim to move slightly forward so there's room for you to climb on behind her.
I'm going to carry us into shore. Doing all right?
Be careful not to tip the board. Keep your legs in the water for stability and paddle back to shore.
Here we go. You all right?
When rescuing someone who is not able to climb onto the rescue board, approach to the side. Grasp the victim's hand or wrist and in one smooth motion, slide off the board to the opposite side while you flip the board toward you. Her chest should be against the far edge of the board. Without letting go of the victim, grasp the far edge of the board with your other hand. Kneel on the near edge of the board and use your body weight to flip the board and the victim toward you.
Placing your knee up on the board allows you to use the knee plus your body weight to turn the victim and the board over a lot easier.
Pull the victim's legs onto the board so she is balanced in the middle of the board with her head towards the bow. Climb on board from the back and lie between the victim's legs. Keep your legs in the water for stability and paddle to shore.
You want to make sure that you place the victim into the center of the board. This allows you to keep the best balance as possible so the victim does not end up back into the water, and it also allows you to paddle the victim back to shore as quickly as possible.
If you find a victim in shallow water, less than 2 feet, modify the head splint technique as follows. Approach the victim from the side and move his arm slowly and carefully into position. Grasp his right arm with your right hand and his left arm with your left hand and secure the head between the victim's arms. After his head is secured, begin to roll the victim towards you. While you roll him to a face-up position, step from the victim's side toward his head. Lower your arm on the side of the victim's that is closest to you, so his arms go over the top of your arm as you step towards the victim's head. You will now be positioned above and to the rear of his head. Maintain arm pressure against the victim's head during this maneuver. Every open water environment is different. To be a successful waterfront lifeguard, you must understand the characteristics of your waterfront. You must also know your team's emergency action plans, know the equipment at your facility, and practice your rescue skills regularly.
Training is the most important thing we do.
If you're going to be able to rescue someone, you must be in condition.
You just always have to be on your guard. You always have to just be watching and watching and watching.
You don't, as a lifeguard, ever really want to have to make a save, but you want to be able and prepared to be able to handle it when it happens. We start with a major orientation training, what the park's all about and what we have to offer and all the fun things that are going to take place this summer. And then we break it down between rides and pools. Actually ride the attractions, understand how they work, and give them a kind of a practice session before we actually go into real operation.
And they show us the ins and outs of the position, show us what we're supposed to do, what we're responsible for, all the things that go along with each attraction.
Scanning the wave pool, the areas where it's most dangerous out here. Slides, the proper way of riding them.
We check them off on everything, make sure they're doing everything right. We'll do a lot of in-service training once we actually get into the season.
One of the main things that a water park environment has is frequency of rescues.
Teamwork is very essential.
On the average, we usually probably have 3 saves a day going in. That doesn't include assist. Probably assist, each guard maybe has 3 or 4 a day of handing small children the tube, dragging them to the shallow end, and just helping people out.
People are here to have a good time. You know, people people spend a lot of money to come here, and some people travel from miles away just to come to our park. So you want to talk to them and make them feel like they're wanted here.
Basically, you're just trying to let the people in the facility have a good time without just getting hurt. And that's what prevention's all about, making sure they're following the rules.
A lot of times you have a language barrier.
We have a lot of foreign visitors here at the park, so the communication between the guards and the guests are very difficult.
You're not sure what language they're speaking sometimes. You do the best you can. A lot of times you have to use hand signals.
Okay, cross your arms, cross your legs. Keep cross to stop.
The basic principles of patron surveillance are no different at a water park than they are at any other aquatic facility. Your focus continues to be injury prevention and victim recognition. But in a water park, the large number of patrons and the wide variety of attractions add significant challenges to your surveillance duties. Each attraction in a water park is unique. The design, the use of inner tubes, mats and rafts, the rules, and the depth and flow of the water. These characteristics change from attraction to attraction and may catch a patron off guard, especially a first-time patron or a poor swimmer. In order to prevent a serious incident, you need to know how each attraction works and where potential problems could occur. The most heavily used attraction in many water parks is a wave pool. Wave pools are zero-depth pools, meaning that the depth of the water gradually decreases from its deepest point at the head wall to its shallowest, a depth of 0. Most wave pools have the capability of generating several different wave patterns. Each of these patterns will have certain points at which the water will be roughest.
We have the diamond pattern, which has a middle wave, which is the biggest, and I can say I do look in the middle a little more.
A lot of people like to gather in that area where the wave breaks, and that's a potential for a lot of people flipping off of their tubes and busting their heads. They catch the tube and it'll ride them all the way back to the shallow water, and somebody could be sitting there and they just run them over.
Waves are not on continually. They run in cycles, on for a certain amount of time, then off, giving patrons a chance to rest. But rest for the patrons does not mean rest for the lifeguards.
That's probably the most dangerous time period, is after the waves have stopped, the first couple of minutes.
People that are out there have been out treading for 10 minutes, they're all going to be tired, even good swimmers.
Many people that can't swim get pushed out by the waves to the deep end of the pool, and once the waves are off, they try to start paddling to the shallow end, and you just have to be careful, listen, watch, and see what's going on.
Learn the characteristics of the waves generated at your facility and adjust your surveillance techniques accordingly. While you are scanning a wave pool, watch closely for patrons who may either drift unknowingly or be caught in the crowd and pushed into deep water. Also, watch for children who cling to the walls of the wave pool. Wave action could push them against the wall, causing injuries, or pull them away from the wall and into water that is too deep for their abilities. Some poor swimmers and non-swimmers may rely on tubes to stay afloat. They are likely candidates for rescue if they fall over or get knocked off, even in shallow water. Large numbers of inner tubes crowded together, bobbing with the waves and bouncing off each other limit visibility. You will be more alert and more able to respond by standing up whenever the waves are on.
On the busy days when you have so many tubes out there and you can't see, and you just got to step up a level to make sure that everyone is safe.
Lifeguard chairs at some wave pools are equipped with an emergency stop button. Pushing the button before you enter the water to make a rescue stops any additional waves from being generated, making the rescue easier. At most wave pools, there will be a lifeguard stationed at the shallow end of the wave pool. In the shallow end, you should watch carefully for patrons who may be caught off guard and knocked over by a breaking wave, or children who may wander down the slope into water that is too deep. If the pool is crowded, an additional lifeguard may be placed in the water, usually in the deep end. Zone coverage in a wave pool will be determined by the size of the pool, the number of patrons, and the number of lifeguards on duty. A much calmer attraction in many water parks is the winding river. Patrons float slowly along on inner tubes, sometimes going through waterfalls and tunnels or under bridges. A winding river is usually not very deep, and patrons are often tempted to engage in horseplay. Stacking inner tubes, flipping them over, and jumping or diving into the river can cause injury.
Bad incidents can happen in calm areas just as soon as they can happen in the really rough areas.
Kids will sit up on the side of their tube, and that seems to cause problems because they'll fall off.
We had to backboard a young man who fell off his tube and hit the side of a wall.
We have a lot of trouble with people trying to jump in because the stairs do tend to get crowded.
Pay close attention to the entrance and exits. Warn patrons to be careful and be ready to assist them if necessary. Be especially aware of what is happening on curves or other blind spots between your station and the station on either side of you. Zone coverage for a winding river is generally set up to accommodate the shape of the river. Lifeguard stations are usually located at entrance and exit areas, as well as various points along the river's path. In some cases, you may need to walk back and forth to make sure you are providing complete coverage for your zone.
Yes, there are blind spots on the river, and that's why we pace the way that we do to try and cover those blind spots. And that's why we have the guards placed in the places that we do so that we can get maximum coverage on the river.
A water park may also have a variety of water slides. Some are enclosed in a tube, some are open. On some, patrons ride on inner tubes. On others, mats. And others may use no equipment at all. Some slides end in catch pools, others in a runout where the end of the slide levels into a flat trough filled with water. Lifeguard stations are located at the top and bottom of the slide, and communication between these lifeguards plays a vital role in effective water slide surveillance. Surveillance for water slides includes much more than watching patrons come down. The guard stationed at the top of the slide has dispatch responsibilities. These dispatch responsibilities include making sure that patrons meet height requirements, ensuring that each patron knows how to use any equipment on the slide, and making sure that they know how to ride the slide correctly. The dispatch guard also is responsible for sending patrons down at safe intervals. The amount of time you allow before sending the next patron down varies depending on the type of slide. On some, you will wait for a signal from the lifeguard at the bottom, telling you to dispatch the next rider. On other slides, you may have to count a certain number of seconds between riders, or wait for a rider to pass a certain point on the slide before sending the next person.
Dispatch is controlled by time, basically, to keep the guests far enough apart so that they don't run into each other, so that they don't present a problem at the bottom of the slide.
When visual communication between the top of the slide and bottom is difficult or impossible, slides are equipped with electronic signaling systems that will cue you when to let the next rider go.
It's a two-process communication system. We have a red and green light system at the top of Blue Niagara where the guard will see a red and blue light. The red light is always on until the guard at the bottom presses a button. By pressing that button, that activates the green light and it tells the guard on top that the coast is clear at the bottom of Blue Niagara.
Watch patrons as they go down the slide to make sure they are riding correctly. If you see any reckless behavior such as unnecessary twisting and turning, attempts at stopping or switching to a head-first position, alert the lifeguard at the bottom of the slide so the patron can be corrected before the next ride. When you are stationed at the bottom of a water slide, be alert for warning signals that may indicate a problem with the patron who is on the way down. If the slide empties into a catch pool, the depth of the pool may vary according to the type of slide. Most catch pools are 3 to 4 feet deep, while others may be deeper. Water rushing into a catch pool may create currents which are capable of knocking patrons off balance, and in some cases might even hold a child or a weak swimmer underwater. To be safe, the dispatch guard will provide a special signal to alert the catch pool guard that a small child or weak swimmer is on the way down. Watch carefully for anyone who becomes disoriented when they plunge into the catch pool. Even in shallow water, a disoriented patron can quickly become an active drowning victim.
Basically, it's people getting turned over in the splash pool and getting disoriented. And when they're disoriented, they don't know which way is up.
A lot of times they'll come down and they'll not be expecting the water to be as deep as it is, and they'll come off of their tube or they'll hit the water, and they may know how to swim, but it's just the depth of the water just surprises them, and then the currents add to that fact, and then it just kind of puts them in a panicky situation.
You are also responsible for making sure the patrons exit the ride safely. Some slides have steep slopes and riders may reach speeds of over 35 miles per hour. There are generally no curves or turns in this type of slide, but it may have small hills or rises. Some of these steep slides are nearly vertical. This steep angle gives riders the sensation of falling as they leave the starting gate. Make sure each patron gets into the appropriate riding position for the particular ride. Making sure each patron is in the correct riding position helps ensure a safe ride. Instead of catch pools, these slides are designed with a runout. The end of the slide levels into a flat trough filled with just enough water to slow the rider to a stop. Warn riders to step carefully over the side of the runout and be ready to provide assistance. Once the rider has stepped safely out of the runout, you can signal the guard on top to send the next patron down. Kiddie play areas are another popular feature in many water parks. Miniature versions of slides are often combined with fountains, play equipment, and structures designed for climbing. Be aware that small children climbing around on wet surfaces are often at risk of falling. Your facility may also have a variety of other attractions that require specific surveillance skills. Learn the characteristics of each attraction and know what kind of problems to anticipate before you take your place at a lifeguard station. When you are guarding at a water park, keep keep in mind that many of the people visiting a water park are not accustomed to moving water or currents and may not even know how to swim. It's your responsibility to help keep everyone safe by knowing how each attraction in your facility works and how to provide the most effective surveillance possible from every station in the water park.
The hardest thing is just watching, making sure you watch.
You never want to take your eyes off the water. Your water is the number one concern.
Anything can happen all the time. You can't ever let your guard down.
Everything's gonna be okay. Everything's gonna be all right. I'm here to help you. Take it easy. Take it easy. Get in.
The rescue skills you already know also work well in water parks. Just as some attractions present unique surveillance challenges, some others require you to know additional rescue skills and techniques. At attractions with sufficient water depth, you should enter the water using the compact jump. Especially if you are entering from an elevated station or head wall. If you're stationed at the deep end of a wave pool and need to enter the water during a wave cycle, try to time your jump into the crest of a wave to cushion your entry. Because guests and inner tubes are moving with the waves, choose an entry point where you will not collide with anyone. If your station is at the shallow end of a zero-depth pool, use the run and swim entry. Hold your tube and excess strap in one hand and run into the water.
On your way out, you want to make sure that you're getting your knees as high up out of the water as possible and clearing your feet out of the water so that you don't trip and fall.
When you can no longer run, place your rescue tube across your chest, lean forward, and start swimming. Never dive or plunge into the water. At attractions where you are stationed in or near shallow water, you will be able to help most patrons using a simple assist. Always keep your rescue tube between yourself and the victim who needs help. Reach across the tube and grasp the victim's armpit to help him get his balance.
And we simply go in and give him a hand coming out of the water, exiting rides or just coming up onto the beach area.
You can also use both hands to grasp his armpits and help him stand up.
A lot of times someone will enter a catch pool and because of the unknown depth, whereas they've been in the slide and it's been a nice smooth ride all the way down, all of a sudden they hit water that they don't know how deep it is. They'll become disoriented and they simply need a helping hand to find which way's up and which way's down.
There are 3 ways to get a victim out of the water from the shallow end of a zero-depth pool. If the victim can walk, use the walking assist.
Okay, I'm going to stand us up here. All right, okay, put your feet down. Down.
Place one of his arms around your neck and over your shoulder, grasping his wrist. Wrap your other arm around his back or waist for support and maintain a firm grasp while you help him walk out of the water. If the victim is unable to get out of the water without assistance, use the beach drag. Do not use this technique if you suspect the victim has a head, neck, or back injury. Once you reach shallow water, stand up and move your rescue tube out of the way so you do not trip on it. Firmly grasp the victim under the armpits and walk backward toward the shore. If another lifeguard is available to help, you can each grasp one side of the victim and continue the removal. Drag the victim far enough onto the shore so that at least his head and shoulders are completely out of the water. Two lifeguards can also use the front and back carry to remove a victim from a zero-depth pool. Do not use this technique if you suspect the victim has a head, neck, or back injury. Once the victim is in waist-deep water, move your rescue tube out of the way and reach under the victim's armpits. Grasp the victim's wrists, your right hand grasping his right wrist and your left hand grasping his left wrist. Cross the victim's arms across his chest. The second lifeguard stands between the victim's legs, facing the same direction as you and the victim. She grasps the victim around the knees.
Okay, ready?
Ready.
Working as a team, lift the victim and carry him out of the water. When you are out of the water, bend your knees and carefully lower the victim to the ground. The techniques you've learned for caring for head, neck, and back injuries in a pool can also be used at a water park. But caring for head, neck, and back injuries in winding rivers, slides with catch pools, and speed slides because of moving water, confined spaces, and extreme shallow water introduce additional challenges.
Spinal, get her backboard.
The current in a winding river may apply pressure that causes further injury to the victim's body. The current may also push the victim into other patrons or into the walls. But you can make the current work for you.
Lifeguard. What happened? What's your name?
Keeping the victim's head pointed upstream into the current will help keep the rest of her body in line. Once the victim is properly positioned, the backboarding procedure can begin. In a catch pool at the bottom of a slide, rushing water can create turbulent currents and surface motion. But it can also create eddies, areas where there is very little movement on the surface of the water. When there is only one slide emptying into a catch pool, the calmest area is usually in the center of the pool. When more than one slide empties into the same catch pool, the calmest water is between two slides or along the pool's edge. When you suspect a head, neck, or back injury in a catch pool, Provide inline stabilization and move the victim to an eddy, where the water is less turbulent and less likely to cause further injury as you provide care.
Back in spinal injury, get help!
In a catch pool, you'll want to move the victim to calm water to get them out of the way of anyone that might be coming down behind them. It's also better for the stabilization process to take place in calm water.
You okay, sir?
Managing a head, neck, or back injury in a speed slide is challenging because of the confined working space. Begin by applying inline stabilization.
All right, how you doing? Really hurt. Can you tell me what happened on the way down?
Right down, I hit my head, my neck's really hurting. Guard's on the way.
Okay, are you feeling any pain anywhere else other than your neck?
No.
Okay.
Additional lifeguards kneel along the outside edges of the slide. Lifeguards place their hands beneath the victim with arms and elbows inside the slide.
Okay, prepare to lift.
On command, lift the victim just enough so another lifeguard can slide the board under the victim. Slide the board from the victim's feet toward his head, making sure that the board extends beyond the top of the victim's head and the straps are not caught underneath.
Okay, go ahead and get the chest strap.
Maintain inline stabilization at all times.
Probably the most important part is lifting the body before the board is placed under the victim. Hand placement and moving the victim slowly and as a unit and as a team is very important. You want to minimize the movement of the body as you're lifting up so the board can be placed underneath.
That's good. Ready? Down.
Lower the victim onto the board and place the straps on top of the victim's body.
Go ahead and get the chest strap.
At this point, you can proceed with securing the victim to the board as you would in any other situation. Secure the chest, hips, and thighs. Then secure the victim's head.
Okay, go ahead and grab the head supports. Okay, what we're going to do is we're going to put these on the sides of your head to keep your head from moving around, okay? Okay. Ready? Go.
You want to keep the head as stable as possible and make sure that the head mobilizers are touching the shoulders and are next to the ears.
Once the victim is secure, carefully lift the board out of the slide and carry the victim to safety.
Ready? Lift.
You need to have one person communicating, making sure everybody's lifting at the same time, pausing, and then stepping out of a slide and making sure that they all work together as a team and move the victim and not one person moving by themselves.
If you find a victim in extremely shallow water, less than 2 feet, modify the head splint technique as follows. Approach the victim from the side and move his arms slowly and carefully into position. Grasp his right arm with your right hand and his left arm with your left hand and secure the head between the victim's arms. After his head is secure, begin to roll the victim towards you. Step from the victim's side toward his head and turn him face up. Lower your arm on the victim's side that is closest to you, so his arms go over the top of your arm as you step toward the victim's head. You will now be positioned above and to the rear of his head. Maintain arm pressure against the victim's head during this maneuver. Although most of the help you provide for patrons at a water park is in the form of simple assists, you could just as quickly be called on to rescue a drowning victim or provide care for a victim of head, neck, or back injury. To be a successful lifeguard at a water park, you must be alert and prepared for any emergency that might occur. Know the characteristics of each attraction at your facility and practice your rescue skills on a regular basis.
I feel that in-service is very important for a lifeguard, and I think it's something that everyone should be required to do by their areas, but also I think it's something that everyone should take onto their own hands.
Quiz yourself. Go through the motions, go through the scenarios. That's going to help you when the accident actually happens.